Hi, good day to you. My name is JC Gotinga. I am a reporter for Rappler, and thank you for joining us on this edition of Rappler Talk. We are privileged to have with us right now the chief of Pasig's transport, or he heads the transportation program of Pasig City. He has an MA in transport economics from the Institute of Transport Studies from the University of Leeds in the UK. He is none other than Anton Siy. Anton, hello. Thank you for joining us.
Yeah, thank you for having me, JC.
Right, so let's get down to it. First up, how is Pasig doing now? Mayor Vico Soto made an appeal to give tricycles a limited run, but the national government didn't like the idea. So how are things going now?
Well, I think one thing we can say definitely is that since we were instructed and the guidelines of the national government were reiterated to us in our discussions, we have been compliant with the national government's guideline on tricycles. There are no more private tricycles operating. However, what we can see in Pasig, and I think this may be the case in other LGUs, is that we still haven't completely solved the transport demand gap that has resulted from the suspension of mass transportation. I think one thing we can see is that even in theory, if health workers are able to get to their shifts, what we can see now is that many of them have to walk great distances. We're hearing stories and getting reports of nurses that are walking 2 to 3 hours from outside of Pasig in Rizal province just to be able to make it to where they'll be on duty. And this isn't something limited to just health workers. We're hearing similar stories from the people who work in essential businesses such as supermarkets.
Right. And how what impact has that made on the well-being of Pasig altogether? Pasig is an entry point into Metro Manila, so you have people going through Pasig who are not necessarily going to destinations within Pasig, but even deeper into Metro Manila. So I imagine that's something that the city also needs to watch, isn't it?
Certainly. One thing we do know about the way Metro Manila transportation works is that there are, well, under normal conditions, open borders and free movement within Metro Manila. So many people, you can almost say that the LGUs of Metro Manila and even the LGUs, the local government units of the adjoining municipalities and Rizal province, are all interdependent in a way. So people who live and work in one LGU may not necessarily live there. So in order for many of these essential businesses to function, we do have to find a way to get people from the places in where they live to the places in where they work and are able to deliver those essential services. And it's been quite a bit of a challenge doing that under the guidelines of enhanced community quarantine, but it's something we're working on every day.
Right. So how are you coping? I mean, what measures have you done to kind of, pull strings together?
Sure. Well, the main thing we've done, the main solution, which I think many LGUs are considering, is that we've pressed into service all the available vehicles of City Hall. We do run a free bus service under normal conditions that augments the public transport supply in Pasig. We've started using these buses as well as the tourist buses owned by the city, and we've also pressed into service even the vehicles used by the Pasig Schools Division. As we all know, schools are being suspended, but the travel demand for essential services hasn't gone away. So we're repurposing those fleets and using them to carry essential travel of health workers. We're also working on. We've also gotten some very generous pledges, very generous volunteering of vehicles of private companies and private fleets, and we're eternally grateful to our many private sector partners that have volunteered to lend us their vehicles and their staff time to help carry people in Pasig. One other thing we've done so far is that we've also repurposed the bicycles used by our Pasig bike share system. We've distributed those to essential frontline staff in Pasig City, and we're working with organizations such as this new organization called Life Cycles Philippines that is working to organize donations of bicycles to health workers that still need to get to where they need to be, and so that they're able to travel some way, one way or another, even without public transport.
So we're nearing halfway into the 1 month quarantine, right? Um, Have you seen some improvement? Yes. So and this has been well documented in the news that the private sector has been helping. Pasig, as you have said, the fleet of buses and all available can provide. You've already put out there, but from what we saw at the beginning of the quarantine or the lockdown, people were um, they were kind of helpless. They were in the streets trying to catch a ride. Have you seen some normalization? I once went on a grocery run, and one of the clerks was telling me that she has to walk home to Rosario every evening, and she works in Shangri-La in Ortigas, the Rustan supermarket there. So how's that coming along? Have there been improvements since we started?
Well, I think definitely one thing we can say is that the first 72 hours of any in dealing with any emergency are always critical. I cannot say for certain. In fact, I don't think it would be a fair statement to say that we've reached normalization. One thing we have to say is that there are still many people we cannot serve given the limited resources of the city. And unfortunately, I believe there are still many Pasigueños and still many people working in Pasig who we still have to find better ways to serve under the conditions of enhanced community quarantine. I think with the suspension of mass transportation services, one thing that we're always thinking about in the LGU, at least those of us in LGUs that work on transport, is that we eagerly anticipate any guidelines that can point us to to the end game of when does mass transportation reopen? Because all of these services which we're chartering, where we're paying for gas, where we're sustaining a large public transportation fleet. Of course, this is stuff the LGU doesn't normally do and which many LGUs aren't set up to do. So one thing which would really help us plan is to see when maybe what that end game looks like. What does it look like to see mass transportation reopen under these conditions? Are there going to be guidelines for how we can get jeepneys and buses or tricycles operating again? Certainly, we are compliant with the guideline that none of those are to operate, but we are eagerly awaiting any guidelines that can tell us, okay, if we have to carry essential staff under the shadow of COVID-19, what do we have to do and how should we operate transportation systems to make sure that safety and health protocols can prevent and stem the rise in the number of cases?
Right. That's a very interesting point that you raised. So we need more guidelines from the national government, more clarity. What's the end game? We're gonna go back to that a little later because I wanna ask you a little bit more about the situation on the ground. What have you been seeing? Kamusta yung mga Pasigueño, yung mga nagko-commute? As you have said, there hasn't been normalization. So on a daily basis, are people still walking? How are they getting around? How are supermarket workers, drugstore workers getting to their workplaces?
One thing we can see is that a lot of people are still walking. A lot of people still need to get to where they have to be. So in the absence of any other transportation, walking is the main option. But then people aren't used to making trips like this, and certainly I don't think it's reasonable to ask someone who will be on their feet all day to walk for 2 to 3 hours to get to where they have to be. So in our office, I think once there was news that we were distributing bicycles and coordinating donations of bicycles even to private offices, a lot of people have been asking us if we could spare bicycles for them to use. And unfortunately, we've had to turn many people away since there's still a backlog demand of over 300 bicycles that our staff may need in order to alleviate some of their transportation difficulties. So I think even after some dust has settled, there are still many people. We can't fully quantify how many yet. Even under normal conditions, it takes a long time to do travel demand studies. But I think what we can see is that there are still a lot of people that are making quite arduous walking trips that we can do something better for.
Right. Okay. Let's talk a bit about the bicycles because that's pretty clever. Um, it doesn't take up a lot of space. It doesn't. You don't have to buy gas to use it. You said there's a backlog of some 300. So how many bicycle units has the city government lent to the essential workers? And are you looking to procure any more within this time? And is that even possible given that we are on quarantine?
Sure. So we've distributed, I think, close to 100 bicycles to our essential city frontline staff. We are, of course, now looking to procure additional bicycles. We are looking for suppliers that can provide the city with bicycles, at least for more of our frontliners to be able to use to go to work. We think that bicycles could be a great way for people to solve their transport needs at this time, even under normal conditions. One core tenet of our office, we are the de facto bikeways and cycling office in Pasig. Even under normal conditions, there are plenty of good reasons to encourage and invest in bicycles for everyday transportation and not just as a form of recreation. But we can see even now, when you have massive disruption of transport, bicycles are just a really great way for frontliners to get to where they have to be. And I hope more people realize that. And I think it's a good thing that the IATF, the Interagency Task Force on COVID-19, explicitly recognized that bicycles were a permitted mode of transportation because you don't have to worry about social distancing when on a bicycle.
Right, right. So now it's just a matter of getting the supply, right? Actually buying
Certainly.
bicycles, right?
Yeah,
And does the city have money for that at the moment?
the city does have money for that. The city does have funds that can be allocated for the purchase of bicycles. So we're actually just trying to figure out the logistics of how many we can feasibly order at this time.
Right. Do you have a timeline? I'm sure there are people from Pasig watching us and would be eager to get their hands on one of those bicycles that you can provide. Is there a specific time frame you're looking at for that?
Well, we have to clarify that any bicycles we're purchasing really are first and foremost to be used as equipment for frontline staff of the city government.
Right.
We can't say for certain at all, and we can't even promise that we can deliver bicycles to every Pasigueño that needs one. However, I believe on the internet, one of the great things we've been able to see is that I believe there are a number of Facebook groups and a number of initiatives on social media to help match potential lenders of bicycles with borrowers, such as this group called the Life Cycles Philippines community. I think some of these initiatives are great, and they're really helping LGUs like us help people get to where they need to be.
Right. In fact, a lot of efforts from private groups and, um, just ordinary citizens that are pooling their resources together is helping us really get through this situation, right? I wanted to ask you about the infirm, those people who need to get their dialysis every week or who are under post-surgery care. How's that coming along? Have there been stories, anecdotes of how people in those situations, especially the poor who do not have their own cars?
Yeah.
Uh, how's that coming along? Yeah.
Absolutely. In the what we call them are I guess when you talk about people like dialysis patients, these are people who aren't necessarily medical emergency cases, but they do need chronic treatment for chronic conditions. We are working on setting up a system to be able to get them transportation on demand, and in the coming days, we will be announcing a solution for people in that situation because in the interest of transparency, this is these of people like that is one reason why we in Pasig City government considered ways to allow tricycles to operate. However, seeing as tricycles are explicitly prohibited, we are working around the clock for a solution to make sure that people who need treatments like dialysis can get them quickly. And we'll announce that soon. We're just finalizing some details.
Right. To the extent that you're at liberty to share with us, so does this involve a private group helping out, or does this involve procurement from the government?
At the moment, we're looking to use city assets for this.
Right. Okay. Awesome. And you talked about, and since we're now at this point, how there was this a bit of friction, or there was a bit of friction between Mayor Soto and the national government when it came to the tricycles. It kind of elicited a strongly worded response, although the president did not specifically mention Mayor Soto. He basically scolded local governments and said, do it according to the letter of what the national government laid down. But a while ago, you said that you'd appreciate more guidelines on what exactly you can and cannot do during this quarantine. So, Please tell us what guidelines are clear to you, what guidelines are not clear to you, what areas specifically do you feel that the national government needs to address or specify further?
Well, I think uh, the intention from us in Pasig City from day one was always to be compliant with any guidelines. Of course, we, as much as possible, want to make sure that we're part of a coordinated response to COVID-19. We definitely want to make sure that everyone is moving in lockstep. This is not a situation in which, even we will concede that this is not a situation in which there can be too much, I guess, dissent or maybe too much disagreement at some point, even if solutions, even if some of us feel that solutions aren't the most perfect, it's a time for us to comply with guidelines handed to us from national government. When I said that we would like more clarity on some guidelines, I think it's quite clear to us in Pasig City that right now mass transportation is completely suspended and that we need to find ways to carry people to where they have to be in the absence of that. Because while transportation is suspended, there are essential activities which are permitted and which we have no choice but to permit. So one thing, I guess the most important thing to clarify on my earlier statement is that it would help us very much to know if there will be guidelines for the reopening and partial operation of any kind of public transportation, uh, even in anticipation of the end of the initial deadline for enhanced community quarantine. Because one thing we see is that the in many other cities where you had lockdowns or quarantines or what have you, the complete suspension of mass transportation actually isn't a completely common occurrence. In fact,
Right.
there are only a few cases we can point to, and this is something that was pointed out to me by the experts of Alt Mobility Philippines. They're a group of transport experts and researchers. Actually, there are protocols for operating mass transportation under COVID-19, and many cities have done so. Of course, with investment in things like disinfection and with new procedures for making sure that the virus is not transmitted through mass transportation. But one thing we do see is that some people do say that mass transportation is a human right, and in spite of this quarantine and this enhanced community quarantine, it would help very much. It would help LGUs very much if there was some kind of coordinated backbone system that can carry people even across LGUs in the same way that our mass transport system would in normal circumstances. So I guess for me, the takeaway to all of that is that if we could if we could have a vision of how mass transport can operate again safely during COVID-19, I think that would put many of us, especially in LGU transport units, more at ease.
That's a very interesting point. Again, I'll go back to that a little later. Right now, I want to ask you, how is the back and forth between local governments, at least in the case of Pasig, and the national government? Do you have a direct line to anyone in particular in the national government, and do they have, is there support coming from them?
Well, I mean, we are in coordination with the Department of Transportation, at least our unit. They're regularly keeping us updated of the routes and schedules of their chartered bus service that travels through Pasig. Of course, what we have to concede, and I think what even they would concede, is that we can't get everybody yet with the services that are currently out there. So I think definitely we do need to work every day on seeing which gaps we can't fill and trying to find ways to fill those gaps.
All right. How has been the, well, it's only been, I guess, more or less roughly 2 weeks, right? But what has been the economic and social impact of the quarantine and the absence of public transportation to the people in Pasig?
I can't speak too much as to the quantifiable economic impact. I think one thing that we know about transportation is that it's a derived demand at the end of the day. There's only a demand for transportation because of the demand for everything else. So I think the shutdown, the ordered closure of non-essential businesses means, of course, that there are many people that aren't going around. There aren't as many people traveling when they otherwise would be at normal times of the day. But I think as far as transportation, it really goes back to what we were talking about earlier, that even during the shutdown of mass transportation, there are still plenty of people whose travel needs are not being met and whose travel needs we can't realistically expect a chartered system to meet in a matter of 2 weeks. I think replacing an entire public transportation system overnight is something that I feel like you'd need some special superpowers to do, and something which isn't completely, I think, realistic in many situations.
When I spoke to you yesterday before we decided to do this program, you talked about how some establishments, I think that was a supermarket, whose manpower was reduced to half because many of them just couldn't make it to work, even if technically they are allowed to come to work, and they're servicing the long queues of people needing to do their grocery shopping. And I'm sure that situation is mirrored in, let's say, drugstores. There are people who need to get to factories. So if you can share with us stories like that.
Oh yeah, yeah. Well, I think yeah. I guess to share that anecdote again in this interview, we are hearing stories about how supermarkets, even if they're allowed to open, and many other businesses, not everyone can report for work. Even in the local government, for one of our security offices during their night shift, I think more than half their personnel still have trouble reporting for work because of the lack of transportation that would otherwise be available to them. In supermarkets, one of the reasons the lines are so long is because people aren't able to be processed at the same rate. Of course, supermarkets now observe social distancing. They only let so many people in at a time. But then I think we're hearing also a lot of stories about how even the staff, like the cashiers and the stockers, can't get to work because of the lack of transportation. And the ones who are able to report often are tired from having to walk so much because of the lack of transportation. I think some businesses are already asking their staff to sleep in makeshift arrangements at their premises. And I think while this is a temporary solution to the transport issue, it also means that people aren't getting so well rested, and it might put us at risk of lowering immunity in certain populations and making them more vulnerable to COVID-19. So I think Alt Mobility's letter, I was able to get a copy of it. I think they're completely on point when they say that public transport is a public health issue. And if there can be protocols to safely operate public transport, it can be actually beneficial for everyone's health.
Yes, thanks for bringing that up. So it wasn't just Pasig City that was recommending the use of tricycles on a limited basis, but also Alt Mobility PH actually does, based on your study. You are asking for that to be allowed, as well as for the national government to identify skeletal routes. Is that correct? That buses and jeeps may provisionally take during the lockdown. Can you walk us through that?
Well, I think maybe what I want to say is that at least from my perspective, I'll leave it to the wisdom of the DOTR as to what they wish to present and what they may consider safe to operate. But I think one thing you can see is that one thing you can see if you study cases of how other cities handled COVID is that there are safe ways to operate mass transport during the state of quarantine, or when you're under a state of some other security measures due to a prevalent pandemic. I think there are some cities, I believe, such as Copenhagen, where instead of shutting down their trains, they actually ran their trains at much higher frequencies for the whole day, so that people wouldn't have to crowd in such a small number of trains, so that there would be more trains per hour, and so that people could spread out among more frequent service. I believe there are also cities in South Korea and China which also implemented very stringent disinfection protocols, where I think buses would be where buses were disinfected at the start and end of every trip. I think not all of these lessons will be applicable to us, of course, but I think what would be very beneficial is if we could take what we can from these lessons that was applicable to the Philippines and find ways to get public transport running, learning those lessons.
Right. Anton, zooming out a little bit, taking off your PASIG transport chief hat for a bit, and just speaking to you as someone who has studied transport economics well. You are an economist as well. You have even worked with the Department of Finance before. So you do have a broader picture of the situation than just PASIG itself. I want to ask you, what is because you've mentioned that one solution that some countries have done was to inundate their streets with buses and trains, more buses, more trains than there are people, so that they can maintain physical distancing while they're on trains and while they're on buses. Is that at all possible, feasible in the Philippines, given that we do have a shortage in the number of MRT trains? That's no news to us anymore. Our bus system isn't as cohesive or coherent as we would want it to be. It's not centralized the way they are in some other countries. So my question to you is, given the realities here in the Philippines, particularly Metro Manila, if you were to recommend measures, if we are to reintroduce public transportation, how should the national government do it, and when? At what point?
Well, here's the thing. I believe that when you shut down a lot of the non-essential businesses, many people aren't going to work anyway. I mean, if you order the closure of all these non-essential activities, you're already keeping a lot of people at home and you're already reducing a lot of loading. So that action in itself can take a lot of people on the road, and I don't think it's quite automatic to assume that people will only stay home if you shut down public transport, because clearly there are economic measures and business regulatory measures that can take a lot of travel demand off the road. So I think that was one thing which many countries did, and which we are also doing. So that part, at least, I think is being applied. I think as far as being able to run higher frequencies, granted, on the MRT and LRT, there are sometimes technical reasons for why this can't be done. However, I think once you remove a lot of travel demand, if the trains kept running, I think there would be definitely reduced loading. For buses and jeepneys, of course, our road transport system is fragmented among hundreds of operators. So this is one reason why we're completely supportive of the PUV modernization program of the Department of Transportation, and why we think it's a good idea to have central dispatch for operators and for the vehicles that will be carrying people on our roads. I think definitely though, we're still a long way from all of that, and I think one concern always with the when you talk about modernization is how to get there. And even if that's the goal in mind, even if that is the goal in mind, we're always eager to see solutions that can minimize the shock, especially to current PUV industry workers and stakeholders.
Right. Given how you've seen the situation so far, how long do you think can we go on like this? Because yes, we know that the initial run of the enhanced community quarantine is until April 12 for the rest of Luzon outside of Metro Manila. In Metro Manila, we're on lockdown until the 14th. But it also depends on whether by then the spread of the virus would have slowed down. And if not, well, we do not know yet, but I think it is possible that we can be on lockdown for longer. Would we be able to survive something like that? How long can we go on like this, as I've said?
Well, I'm not really an expert on epidemiology, so I don't know if I can answer that question correctly. But what I can say as someone who handles local government transport is that it can't be the end game for public transportation, for like maybe a picture of how we can reopen it and operate it safely. I feel like that can't come soon enough. I mean, if you gave it to us today, it would help. If an end game for that could be drawn up today and presented to everybody, especially us who are planning transport, I think that would put a lot of people very much at ease. So I think being able to see that would give a lot of people a lot more breathing room and allow us to manage the effects of a lockdown much better.
And if you were to draft this end game, how would you do it?
Well, I think maybe the most important thing is to assume that some level of transport operation, some level of public transport operation is something that is desirable to restore immediately or as soon as possible. So I think
Okay.
definitely even in normal circumstances, public transportation has to be treated as an absolute priority. One lesson I think I hope we all learn from this experience is that it's really something which certain parts of our population, especially those who we consider essential frontliners, it's not something they can do without easily, and it's something which we need if we want people fighting at the front lines of something like COVID. So I think for me that would be the number one goal, that we can't assume that it is acceptable for public transportation to be indefinitely suspended. I think in the absence of operating public transport, I think it's very important to let everybody know when this can come back and come back safely.
Right, and you mentioned safely. I was going to ask you about that because I think the hesitation in terms of letting public transport, um, back on the streets is that, we need to do physical distancing, and the virus
Yes.
might spread if we take the same buses, we take the same trains, we take the same jeeps. So, from what you can see, how can this be done in a way that does not contribute to the spread of the virus?
Sure. I think there are many measures which are being done in other countries by many other public transport operators. I can't name all of them at once, and certainly I might
Yes.
forget when talking about them. But I think one of the keys is definitely number one, you have to control non-essential travel to make sure that there's no loading that doesn't have to be there. I think we're doing that correctly. I think there have to be good disinfection and sanitation protocols for all the vehicles. I think even though we have fragmented operators among our different systems, it might be a good thing if government can step in and provide and assist with some of that disinfection and sanitation. And I think where possible, there might have to be, since our public transport system is entirely run by small private operators. Sometimes an operation can be as small as just one jeepney with a driver operator. I think if they're going to be running with reduced loading conditions, in order to not have them charge very high fares, the government should provide some kind of financial support to enable good service at reduced loading, and enable frequent service at reduced loading. And I think the government has already considered some kind of financial assistance. So those for me are the main tenets of a plan that would reopen public transport under COVID-19.
Right. Thank you. We've covered a great deal of topics
Yeah.
here, and thank you very much for joining us. But for a final note, going back to Pasig, still two weeks more left to the quarantine. Um, what do you need? Any call out that you want to put out there, so that to help ease the situation in your city?
Sure. Well, I think as far as transportation, there's still lots of medical frontliners who need to get to work. We're trying to organize other high capacity transport services as much as we can. However, the quick solution we're seeing is that bicycles are absolutely great. Even without COVID, I've been biking to work for 3 years and I've never looked back. And I think one thing I'm really happy to see is that more people are starting to recognize how powerful of a tool bicycles can be in these situations. So anyone out there, if you have a bicycle to lend someone, go online. I think on Facebook there are many initiatives. Find somebody you can lend a spare bicycle to, because it can really make a big difference. And this is something which we really want to encourage throughout this quarantine and going forward. I think I can't speak to the exact needs of our medical department or our hospitals. However, I believe any donations of things like personal protective equipment will be wholly welcome. There are many channels for that. So I think any hospital would be willing and very happy to receive those. And besides that, I think I just want to thank everyone. Many people have given great words of support to us in Pasig, and those really nice messages really keep all of us going.
All right, thank you very much. Thank you for the work that you do. Keep well, stay safe, and as much as possible, as you keep telling us, stay home when you're
Stay
not needed
home.
in the field.
Yes.
Yes.
I need
Thank-
I need to tell people that if you don't have to travel, if you don't need to do any of the activities classified as essential travel, I know I like riding my bike, but don't if it's just to ride your bike outside and you don't have to, please stay home. Do some
Get a
push-ups or whatever.
yeah, get a stationary one.
Yeah,
In
yeah.
the
If
house.
you can use a stationary bike, if not, go read a book, get on Facebook, just stay home.
Exactly. And on that note, Anton, thanks so much for joining us. God bless you on the work that you do.
Thank
To
you.
everyone else, thank you for joining us here on Rappler Talk. Keep watching the Rappler page for more of these conversations. Thank you. Have a good day.
Yes,
Keep
thank
well.
you, JC. Thank you.